the use of neoadjuvant targeted therapy in the management of HER2-positive early breast cancer has increased, as we know.
Certainly.
What potential advantages and disadvantages do you see are associated with neoadjuvant therapy?
Yeah, so neoadjuvant has been around since I was a trainee, but originally it was fairly straightforward. It was the patient with inflammatory cancer or the patient with a locally advanced cancer where the surgeon was not confident of being able to completely and safely remove the tumour, were referred for some neoadjuvant for inflammatory because it was shown a long time ago that it improved the outcomes, for the locally advanced so that we could do the surgery. From that time, the next step was where the NSABP and other trials showed that although neoadjuvant did not improve survival or in the overall groups, it certainly allowed more patients to have breast-conserving surgery. So the surgical approach was if you could not achieve satisfactory breast conservation and the patient wanted it, then neoadjuvant should be considered. And I think that's where it was up until quite recently. I remember going to a lot of meetings where people from big cancer centres talked about the research value, and when I put my clinical surgeon hat on, it was, well, that's all very good, but there's no research happening here, so that's not relevant for me. I think recently, particularly with the results of the CREATE-X study, and then the more recent study, you'll need to remind me, is it Catherine?
So the Catherine study,
in HER2 positives, those have shown that the response to neoadjuvant therapy can be used to improve treatment. And I think that's those studies are game changers, because in the end, the patient wants the maximal chance of cure. And if you can improve a chance of cure with by using neoadjuvant and altering treatment according to the results, it becomes a new standard. I think that's where we're headed.
Absolutely. I mean, I often wonder, and I don't know whether there's any data, whether patients are more motivated if they see they're on systemic therapy and they see the tumour shrinking. I think it takes away that, a complete uncertainty in the adjuvant setting where we give sometimes 6 months of chemotherapy to patients and they ask, is it working? And we all sit there and say,
Yes.
I don't know.
Yeah, that's interesting. That's where a step in the evolution was that we knew that the response to neoadjuvant was important prognostically, and that was put as a reason for using it. And I guess the one part of me said, that's fine, except if you find that have a poor prognosis.
That's right, although I guess we now have the ability to make better decisions for those patients who don't respond well.
And that's where it changes.
Yeah, absolutely. Do you see any disadvantages other than, I guess you've just mentioned, if you don't respond, it's potentially a disadvantage. You've got the tumour still in situ.
And I think, one wonders if you've got a tumour that is not responding in situ, would it have been better to just get rid of the tumour? Surgery cured some of those patients, and we like to do it sooner. I think that's more theoretical because we know from the whole group that the outcomes are better, as we've just discussed. Psychologically, it can be difficult. You would have patients, I certainly have patients who come back frequently, they want more imaging, they ask the question, should we operate? I think they're saying, I want an operation, and we need to be just confident that this is good treatment.
Yeah. Neoadjuvant won't be the appropriate approach for everyone. No, I think that's right.
One other, it's not a disadvantage, but it's a surgical complexity, is that we need to have very good mechanisms for marking tumours, for localising the site of tumours early on in one's experience. Many have been in the situation of approaching surgery and actually not knowing exactly what needs to be done. I think we've got around that. Radiologists are routinely clipping tumours at the time of biopsy. So it's not a disadvantage, but it is a complexity that gets...
It's the true poster child of a multidisciplinary team.
Oh,
Like everyone
undoubtedly.
has to be involved from the get-go.
Yeah, yeah.